So, hi everyone. Welcome to this webinar pertaining to cesarean birth versus natural childbirth. This would serve as a guide for pregnant and would be pregnant mothers or couples who are already pregnant or who are going to be pregnant in future. So, I'm Dr. Richa Saxena, an obstetrician gynecologist, and I'm also the founder of this initiative, Let's Talk Women's Health, which aims at enlightening and empowering women through education. So, topics for discussion today: normal labor, mechanism of normal labor, benefits of natural childbirth, risks of natural childbirth, cesarean birth, indications of cesarean birth, risks and benefits of cesarean birth. So, normal labor or natural childbirth or a normal vaginal delivery, it is possible in nearly 85% of women, that is, out of 100 women, nearly 85 would be able to deliver normally. And natural childbirth can be considered as a miracle of nature because the way the baby is born, if somebody has watched it, it truly appears to be a miracle of nature. There is no denying the fact that normal vaginal delivery or natural childbirth may be associated with a lot of pain and agony, and also it may be slightly more prolonged as compared to a cesarean birth. But once the baby is born and the mother sees the smile on the baby's face, that is something which makes life worth living. Because if you see the smile on your baby's face, all your past sufferings and all your agonies which you have gone through at the time of giving birth, all that is gone and you don't remember any of that. You just see the smile on baby's face. So now talking about the stages of normal labor. So let's look at the anatomy before we dive into the stages of normal labor. And you can see that the baby's head is pointing downwards, the baby's body is upwards, the placenta is also placed upwards. So this is what is known as the cephalic position, and you can see this in further details here, that the baby's head is placed downwards, and this you can see is the birth canal or the cervix, which here is tightly closed. So before the labor begins, this cervix or the birth canal, cervix is the lower part of the uterus, and this you can see is tightly closed and it is applied against the presenting part. This is the placenta. This provides the nutrition to the baby from the mother, and all the nutrition from the mother travels to the baby via placenta. And this is the umbilical cord you can see, which connects the placenta and the baby. And this is which is cut at the time of normal vaginal delivery. So we spoke about the head position. Now there can be some abnormal positions as well. So sometimes instead of the head presenting, you can have the baby's legs or buttocks presenting, and this is the breech presentation, which you can see here. And sometimes instead of either the head or the legs, it is the shoulder which is presenting, and this is known as the shoulder presentation or the transverse lie. So in case of transverse lie, there is no mechanism of labor and you have to do a cesarean section in these cases. So in breech presentation, the mechanism of birth is there. The baby can be delivered vaginally, but we prefer that a cesarean section is done, basically because the normal vaginal birth may be associated with more risk to the baby. And this is to describe the anatomy further. You can see that the baby, when it is placed, or whatever position the baby is placed in, it is surrounded by these membranes. You can see these slightly bluish structure. These are the membranes. These are the amnion and the chorion. They will be surrounding the baby, and within the membranes and the baby is a fluid which is known as amniotic fluid, which is present. So at the time of labor, how do you know the labor has started? The labor starts with the onset of uterine contractions, also known as the labor pains, which will come and go. So in the beginning, the frequency of these contractions they are less frequent, and later as the labor progresses, these contractions, they become more frequent, and with this there will be rupture of membranes. With the onset of uterine contractions, there is rupture of membranes, there is presence of bloody show. So these membranes which are surrounding the baby, towards the beginning of the labor, as the cervix or the birth canal it starts opening up, these membranes they begin to bulge out and they eventually rupture. So when the membranes rupture, the fluid which was here, it leaks out, and that is what is known as the water breaks. The women will suddenly feel a gush of water coming out of her vagina, and this is what is happening. That is, there is a rupture of membranes, and this is a definite sign of labor. Also, there may be blood tinged discharge, which is known as bloody show, which may be seen at this time. And as we have discussed previously, that the cervix or the birth canal, it starts opening up, as well as the wall starts becoming thinner. So to explain this further, you can see that this is the cervix before the labor begins. So it is closed, you can see here, and also the wall is very thick. Now what happens when the labor begins is that this cervix, it starts opening up, and it opens up to such an extent that it becomes almost 10 centimeters open. When it becomes 10 centimeters open, that is the point when it is known as fully dilated. Also, the wall which was thick, it starts becoming thinner and thinner, so that the passage is created through which the baby may be able to pass easily. So towards the end of first stage, cervix becomes fully effaced, that is, the walls also become paper thin, and it is about 10 centimeters dilated. So you can see that here towards the end of first stage, the cervix is open enough, that is, it is 10 centimeters dilated, and it is now paper thin. Since it is paper thin, it becomes stretchable, and so the baby's head can easily negotiate out. So this you can see that the further the fetal head or the baby's head is negotiating out. So with the end of first stage of labor, first stage of labor basically starts from the cervical dilatation to the cervix becoming fully dilated and fully effaced. So the first stage of labor ends. With the end of the first stage of labor, the second stage of labor starts. And second stage of labor basically starts from the point where the cervix is fully dilated and fully effaced, and it ends with the fetal expulsion, that is, expulsion of the baby. So in the second stage of labor, the mother, she will be contracting her abdominal muscles, and at this point of time, she'll be asked to push the baby out. So as the mother applies force and the baby is pushed out, you can see that the head, it is coming out further and further, and eventually the fetal head is delivered, followed by the rest of the baby. So you can see with the help of pictures that how initially a little part of the fetal head is visible, and as the mother continues to push, more and more fetal head starts appearing out of the vaginal introitus, and eventually you can see the baby's eyes, the baby's nose are emerging out, and eventually the whole of the baby's head is delivered. And you can see in this video that how the baby's head is moving out. You can see that what's happening. So as the baby moves down, the baby's head is also coming out of the cervical os. Once the baby's head comes out, it is delivered by the doctor or the obstetrician, and you can see here the doctor delivering out the fetal head. Once the baby's head is delivered, the rest of the body subsequently follows. So here with the help of a small video, you can see that how after the head is delivered, the rest of the body would be delivering out. And once the whole body has delivered out, that is the end of the second stage of labor. So you can see here that the baby is moving out. And once the whole baby has moved out, you can see that the placenta, it remains inside. The umbilical cord is cut and the baby is handed to the pediatrician and the baby is kept in the incubator. The placenta remains inside. So now the third stage of labor starts, wherein the placenta is delivered. So the benefits of natural childbirth. I am a advocate of natural childbirth, and this is associated with several benefits. The first one being it is associated with a shorter duration of hospital stay because it's a natural procedure and it is something which has been devised by nature. It is physiological, so there is not much injury or damage caused to the mother, and if everything remains normal, she can be discharged within 24 to 48 hours and sometimes even earlier than 24 hours. Following a normal birth, there is a very quick recovery and she can return to her routine activities within few weeks. So natural childbirth also helps in avoiding the risks associated with cesarean delivery, and this includes complications such as scarring or the scar formation because the cut is given in the uterus and the abdomen. Also, it helps in avoiding complications such as infections, reactions associated with anesthesia, and severe bleeding which may occur at the time of surgery. Since there is no anesthesia which is given except for maybe epidural if the woman requires, the mother is quite conscious after the delivery, and so the baby can be quickly given to the mother. So quick reunion with the baby, and as a result the mother can breastfeed the baby much easily. Early breastfeeding facilitates better bonding between the mother and the baby, and this helps in development of this bond, which is a very special bond between the mother and the baby. Other benefits of natural childbirth: lower risk of respiratory problems. Why lower risk of respiratory problems? Because what really happens is that in the baby, the lungs, when the baby is inside the mother's womb, the lungs, they have not developed very efficiently, and after the baby is birthed, these lungs, they start expanding, and this occurs, the expansion of lung occurs because of presence of a protein which is known as surfactant. The surfactant may not be produced if the delivery occurs before 37 weeks or sometimes even before 38 or 39 weeks. So if a cesarean is done prior to the development of surfactant, there may be respiratory problems in the baby and the baby may not be able to breathe properly. But if the baby is born through natural birth at term, then there are no respiratory problems which are likely to occur. Also, natural childbirth provides better immunity to the baby because the bacteria from the mother gets transferred to the baby, and this results in the development of better immunity in the baby. And last but not the least, since the mother is required to stay in the hospital for a very short duration of time and no major procedure is done on the mother, so the cost is also pretty less in comparison to a cesarean delivery. However, all good things will also come with their baggage of risks. So there are certain risks also which may be associated with natural childbirth, and the first and the most important risks which are associated with natural childbirth is injury to the pelvic tissues, pelvic muscles and the anal sphincter. That as the baby's head is emerging out, if too much force is applied or if the baby's head is slightly bigger than the maternal passages, then the surrounding structures may be torn, and especially if the mother pushes with a lot of force, then also there can be tears which may occur in the pelvic structures, in the pelvic tissues, in the pelvic muscles, and this region which is between the vaginal introitus and the anal opening. You can see this is the urethra, this is the vaginal opening through which the baby is being born, and this opening here is the anal opening through which the feces pass. And this area between the anal opening and the vaginal introitus, this is the perineum, and this perineal tissues, they might be injured or there may be tears and lacerations occurring here as a result of natural childbirth. And sometimes even the sphincters of the anus or the urethra may be injured, so there may be blood-stained urine, there may be fecal incontinence. All this is taken care of, but these things are rare, but they may at times happen. So other risks associated with natural childbirth include injury to the baby. So especially if the baby is of a bigger size, which is also a condition known as macrosomia, that is the baby's weight is more than 3.5 or 4 kgs, or in cases of difficult labor where forceps or vacuum have been applied. So in those cases, there are chances of injury to the baby. There may be development of lacerations, bruises, hematoma, there can be nerve injuries, there can be sometimes even fractures of clavicle or collarbone. So these are the things which can occur as a result of natural childbirth. Perineal injury pain, we've spoken about that. Even if there are no tears, sometimes in order to prevent the occurrence of tears, your doctor may give you a cut which is known as an episiotomy. And this cut, I'll talk about this in the later slides, this cut is stitched. So there may be some soreness in your perineum till the time this completely heals. And the best way to get rid of this soreness is to use seeds bath. So to prevent the tears, we normally give a cut which could be in the midline or it could be slightly on the lateral side like this. So when this cut is given, this enlarges the space and so the baby can be born easily without causing any tears. And once this baby is born, this cut is then closed with the help of stitches. So it may take some time to heal properly. Until that time, there might be some soreness. So now let's talk about cesarean birth. Cesarean birth is a major surgery where a cut is administered over the abdomen as well as the uterus after 28 weeks of gestation. So usually in cesarean birth, the cut is administered after 28 weeks of gestation. 28 weeks of gestation because this is the time when the fetus or the baby is going to be viable outside the uterus. So usually now you can see in this image, this is how a cut for cesarean section would be given, and this is given over the skin of the abdomen, the subsequent tissue layers, and then we encounter the uterus. So over the uterus also a horizontal incision like this will be given. Sometimes, very rarely, a vertical incision is also given over the uterus as well as over the skin. Again, this is under very rare situation, and usually a horizontal cut, which is also known as the Fannin steel incision, is usually given. So the timing for cesarean delivery, the cesarean delivery could be done as an emergency procedure. It could be done as an elective procedure, or cesarean section can be sometimes also done on maternal request. So what are each of these? So an emergency cesarean section basically is performed in case of an emergency. That is, you need to save the life of the mother or the life of the fetus, because there may be some situation where the life of either of them is in danger, and to save their life, you want to expedite the delivery, and the natural birth or the vaginal delivery may be taking some time. So in that case, to expedite the procedure, you may have to perform a cesarean section. Again, a cesarean section under this situation, an emergency situation, is completely justified. An elective cesarean section is a section where the doctor decides in advance, because the doctor realizes that there's some situation which is present. It could be the baby is in breech, or the baby is in transverse lie, or the placenta is low-lying, and the doctor feels that yes, you need to go ahead with the cesarean delivery in any case, or it appears that her pelvis is not adequate and she may not be able to have a normal vaginal delivery. So in this case, the doctor posts the women for cesarean section at a predefined date, that okay, probably around this time you will be 39 or 40 weeks. If she goes into labor before that, then obviously on an emergency basis, a cesarean section may be done. Then the third one, which I don't recommend, is cesarean delivery on maternal request. Mothers under social pressure, or maybe because they have heard some horror stories from their friends, or just for the sake of fantasy that no, I would want to have a cesarean section because I don't like, or I don't want to get normal vaginal birth, they may just opt for cesarean delivery. Again, this is a valid indication, and a doctor can operate on a mother based on her request. and there is no medical reason for cesarean delivery in these cases. But I myself, I do not recommend this. I discourage the mother. If she does come with such a request, I try to counsel her and try to make her understand the risks associated with cesarean delivery and the benefits of having a vaginal birth. So what are the indications for cesarean delivery? The most common indications, one is dystocia. What is dystocia? Dystocia is basically slow progress of labor. So this dystocia, it could be because either the labor is not progressing properly, the birth passages, they are not developing the way they should, or she's not able to push properly, she's too tired, or she maybe has a heart disease or something, and because of which she is unable to push. So under those situations, dystocia is the most important reason why a cesarean delivery may be done. A previous history of cesarean delivery, again, this is not a must that with a previous history of cesarean delivery, you necessarily need a cesarean section in your subsequent deliveries as well. But the risk of having a cesarean delivery in the subsequent pregnancy increases. So previous cesarean section is not always the indication for subsequent cesarean deliveries. It depends on why the previous cesarean delivery was done. Then the next indication for cesarean delivery is abnormal presentation, which we have discussed previously. The baby is in breech, or the baby is in shoulder presentation, or the baby's heart rate is dropping, that is the fetal distress, or preeclampsia, condition where mother develops high blood pressure during pregnancy. Again, the only way or the only treatment for preeclampsia is that she is delivered. So to hasten up the delivery sometimes, and to ensure that the mother doesn't suffer from consequences of hypertension, you may have to undertake a cesarean delivery. So procedure of cesarean delivery, I have explained to you that a cut is given over the abdomen as well as the uterus, and once the cut is given in the uterus, in this clip you can see that through the cut which is given in the uterus, the surgeon extracts the baby's head in a similar way how it was done in case of a normal vaginal delivery. The difference is here you are extracting it from the uterus. There it was coming on its own out of the birth passages. And in the next clip, you can see that the baby's head is out, and then subsequently the baby's body is also delivered from the same cut which is in the uterus. So you can see here the baby's shoulders are delivered, and then the rest of the baby is delivered. And similarly, the umbilical cord is clamped and cut, and the baby is handed over to the pediatrician. So benefits of cesarean birth. Again, this is a very important life-saving emergency procedure. So in an emergency, a cesarean section, it works as a boon for the mother and the baby because it is able to save both the mother's as well as the baby's life. So this is the most important benefit of a cesarean birth. It can be life-saving in emergency. Secondly, it is a more convenient option because it is more convenient, it is more predictable. You know that the baby would be born within maybe, the procedure per se takes about half an hour to 1 hour. And if you count the anesthesia and everything, maybe within 2 hours, you can consider that the baby would be born after a cesarean birth. And it also helps in avoiding the long, painful labor which occurs with a normal vaginal delivery, because this helps in cutting short. It bypasses the first and the second stage of labor when the birth passages, they were dilating and they were effacing. So all that is not happening in this case. So obviously it becomes a faster and a less painful route. The pain may not be there during the surgery itself because the anesthesia is given to the mother and she's under the effect of anesthesia. But once the effect of anesthesia wears off, she might start feeling the pain, and the back pain and the pain in the abdomen. It may last for nearly 6 weeks to 8 weeks till the healing of the scar is complete. And in case she does develop some other complications like infection or something else, then again the recovery may be even more long. Then another benefit of cesarean birth is it helps in avoiding passage of infections infections such as AIDS and genital herpes, which may be passed from the mother to the baby. This helps in preventing that. Last but not the least, cesarean section may be the only alternative in some special situations. So some special situations which we have discussed previously, that is the baby is presenting by breech, or the baby is presenting by transverse slide, or the baby's size is very big. That is a condition known as fetal macrosomia. So if the baby is very big in size, more than 3.5 to 4 kgs, in those cases, you may require to deliver the baby through a cesarean section. And cesarean birth is the only alternative which is safe for the baby in these cases. Then the risks of cesarean birth, there are plenty, because this is a major surgery. So it is associated with a long duration of hospital stay, which may vary from 3 to 4 days to a week. And the women may have to visit the hospital again to get her stitches on the skin. Then again, because it is a major surgery, there might be more physical complaints, such as the women may experience more pain, there are more chances of infection at the site of incision. There's a risk of blood loss, because again, with a major surgery, sometimes the women may encounter heavy blood loss. Also, inadvertently, the surgeon may sometimes injure the nearby organs like the intestine or bladder. So this can result in further complications. Then, because after the surgery, the mother may be under the effect of anesthesia, so it may not be possible to immediately give the baby to her after she has undergone a cesarean section. So baby may be separated from the mother for a longer period of time in comparison to a normal vaginal delivery. And as a result, the chances of starting early breastfeeding, they reduce, and the chances of developing that bond, the maternal and child bond, that also become lesser. Another risk, which I consider as the most important risk associated with the cesarean section, is the woman, she becomes high risk. So in subsequent pregnancies, the mother, she becomes high risk. High risk, why does she become high risk? Because she has a scar in the uterus. So in subsequent pregnancies, the scar has a risk of rupturing or giving way. And if this happens, this becomes a life-threatening emergency situation, and it may even cost women her life. Though the chances of this happening is very, very low, but still there is a chance that this may happen. This will never happen with a normal vaginal birth, but there is a small risk of this happening with a cesarean section. Okay, and another thing which we have discussed previously also, that the women, she may require, because she's a high risk, in the next delivery, the doctor may not take that much of a risk, and with a previous history of cesarean delivery, even if there is a little complication present, they will try to have a cesarean section in those cases. Then a previous history of cesarean delivery is also associated with higher risk of placental abnormalities in the subsequent pregnancies. Now, what are these placental abnormalities? These placental abnormalities, they include placenta previa and placenta accreta. So what are these? We'll now see what these are. So placenta previa is that the placenta is present in the lower uterine segment. So we had seen previously, like here you can see that normally placenta is present in the upper uterine segment. But in placenta previa, this placenta is present here. So when the birth canal, it starts dilating, the placenta, it shears off, and as a result, massive bleeding can occur. So this also becomes a situation where an emergency cesarean section or a cesarean section becomes essential. Plus the chances of this happening, if you've had a previous history of cesarean section, this also increases. So you can see here in this picture that this placenta is low-lying. It is covering the cervical, the birth canal, and as a result, if the dilatation of cervix occurs, that is, it starts opening up, this placenta gets sheared off from the walls of the uterus, and this results in bleeding. So this becomes an indication for cesarean section in the subsequent pregnancies. Plus, this condition per se is also associated with severe blood loss, and it may be life-threatening for the mother at times. Another placental abnormality, which is associated with previous history of cesarean section is placenta accreta. So what is placenta accreta? Here the placenta is abnormally attached to the uterine surface. You can see that this is this jagged line. So placenta, at the time of placental delivery, the whole placenta is not delivered or not extracted because it is abnormally attached to the uterine surface, and some placental bits may remain inside and they may result in bleeding even after the baby is been delivered. So again, this is a situation which is likely to occur as a complication of previous cesarean delivery. In the subsequent pregnancies, this condition is likely to occur. So you can see that cesarean delivery is associated with more risks. The major advantage is that it is a life-saving emergency procedure, and I believe that it should be used mainly for that cause as an emergency procedure and not on maternal request. So I am a supporter of natural childbirth unless there are definite indications for cesarean. So thank you so much for listening. And in case you are interested in talking to me or you are interested in booking a teleconsultation, you can give me a call at this number below. And if you do like this video, please do subscribe for more such videos. Thank you so much.